Hello friends, welcome to week 8 lecture that is on antibiotic susceptibility testing of the basic course on antibiotics for medical students. In the last lecture we discussed about the antibiotic resistance. Today we will discuss about the method of testing for the susceptibility, interpretation of results, clinical relevance of the susceptibility testing. So antibiotic susceptibility testing is a laboratory technique used to determine the effectiveness of antimicrobial agents such as antibiotics against specific microorganism. The goal of AST is to identify the susceptibility or the resistance of a microorganism to various antimicrobial drugs. This information is very important for guiding the doctors or clinicians in selecting appropriate antimicrobial therapy for treating bacterial or fungal infections. So we will discuss now the methods of antimicrobial susceptibility testing. There are several methods used for AST include first one is disk diffusion method by that is kirby-bauer method. This method involves placing of antibiotic impregnated paper disc on agar plate inoculated with the test organism. The antibiotic diffuse into the agar and inhibit bacterial growth around the disc, creating a clear zone. The size of this zone indicate the susceptibility of the microorganism to the antibiotic. Second is the broth dilution method. This method involves diluting antibiotic in a liquid growth medium and add the test organism into that. The minimum inhibitory concentration is determined by finding the lowest concentration of the antibiotic that prevent visible growth of the microorganism. Third one is e-test method. This method uses a plastic strip impregnated with a gradient of antibiotic concentrations. The strip is placed on an agar plate inoculated with the test organism, and the MIC is determined by a point where the bacterial growth intersect the strip. Fourth method are automated systems. These systems use advanced technology to perform antibiotic susceptibility testing quickly and accurately. They often combine multiple methods and provide rapid results. For example, Vitek from the bioMérieux. Importance of the antibiotic susceptibility testing is that it plays a vital role in combating antimicrobial resistance by providing information on the susceptibility pattern of microorganism to various agents. This helps clinician make informed decision about the selection, doses, and duration of antimicrobial treatment, leading to improved patient outcome and reduce antimicrobial resistance. Then guidelines and standardization. AST is performed using the standardized laboratory methods and follow guidelines established by organizations such as Clinical and Laboratory Standard Institute, that is CLSI, and second is European Committee on Antimicrobial Susceptibility Testing, that is EUCAST. These guidelines ensure uniformity and consistency in testing procedure, interpretation criteria, and reporting of the results. Interpreting the results of antibiotic susceptibility testing involves analyzing the data to determine the susceptibility or resistance of microorganisms to different antibiotics. This information helps the clinician to decide on the most effective treatment for an infection. So there are three major categories. That is, first one is susceptible. The organism is inhibited by antibiotic at a concentration achievable in the body, indicating that the antibiotic is likely to be effective for treatment. Second category of the result is intermediate. That is, the microorganism has a reduced susceptibility to the antibiotic. The antibiotic may still be effective at higher dose or in specific body site where the drug concentrates. And third category is resistant. So the microorganism is not inhibited by the antibiotic at a concentration achievable in the body, indicating that the antibiotic is unlikely to be effective for treatment. Then there are various steps in the interpretation. First step is the measurement of the zones of inhibition. For the disc diffusion method, the diameter of clear zone around each antibiotic disc is measured. These measurements are compared with the standard reference values provided by organizations such as CLSI or EUCAST. Second method is determination of MIC value. For methods like broth dilution and e-test, the MIC is determined. The MIC is the lowest concentration of antibiotic that prevents the visible growth of microorganism. Third is by comparison with the breakpoints. The measured zones of inhibition or MIC values are compared with the established breakpoints. Breakpoints are the threshold value which are defined by guidelines that categorize the microorganism as susceptible, intermediate, or resistance to the antibiotic. Then final step is reporting the results. The results are reported in standardized format indicating susceptibility categories, that is susceptible, intermediate, resistant for each antibiotic tested. Some laboratory may also provide the actual zone diameter or MIC value along with the interpretation result. And last is the clinical consideration. While interpreting the AST result, uh, it is not involves more than just the laboratory data. Clinician must consider the site of infection. For example, whether the antibiotic can reach effective concentration at the infection site, the status of patient immune system and the comorbidities, then potential drug interaction and side effects, and the local antimicrobial resistance pattern and guidelines. For example, let's assume a bacterial isolate is tested against ciprofloxacin using the disk diffusion method and the zone of inhibition is 28 mm. According to CLSI guidelines, a zone diameter of more than or equal to 21 mm indicates susceptibility. Therefore, the isolated is classified as susceptible to ciprofloxacin. By understanding these steps and consideration, clinician can make informed decision about the antimicrobial therapy, optimize the treatment outcome, and minimize the development of resistance. AST has significant clinical relevance as it is directly impact patient care and public health. So here the key aspects of this clinical importance of AST. First is the optimizing antibiotic therapy, that is personalized treatment. AST provide critical information that help clinician to select the most effective antibiotic for treating infection based on the susceptibility pattern of the pathogen. This personalized approach ensure the patient receive the best possible treatment, which lead to the faster recovery and reduce the complication. Second is dose and duration. By determining the susceptibility of microorganism to various antibiotic, AST guide clinician in deciding the appropriate doses and duration of the treatment. This minimizes the risk of underdosing, which can lead to treatment failure, or overdosing, which can cause adverse effect. Then reducing the antimicrobial resistance by stewardship programs. That is, AST data is crucial for antimicrobial stewardship program, which aim to promote the responsible use of antibiotic. By using AST result, healthcare facilities or hospitals can implement strategies to prevent the overuse and misuse of antibiotic, thereby reducing the development and spread of antimicrobial resistance. By the epidemiological surveillance, AST results are used to monitor resistance pattern and trends in different regions and hospitals. This surveillance helps public health authorities identify outbreaks of the resistant infection and to assess the effectiveness of current antibiotic policies and develop new guidelines for antibiotic use. Enhancing the patient outcome by preventing the treatment failure and or by using the correct antibiotic based on the AST result reduce the likelihood treatment failure, which can lead to the prolonged illness, increased healthcare cost, and higher the mortality rate. And effective and timely antibiotic therapy guided by AST can shorten the duration of hospital stay and reduce the need of intensive care and lower the risk of hospital acquired infections also. Then select the right antibiotic based on the AST, minimize the risk of adverse drug reaction and potential toxicity, improving overall patient safety and quality of the care. Then in AST is particularly important for immunocompromised patients, those with cancer, HIV, or organ transplants, who are more susceptible to infections and may require specific effective antibiotic therapy to manage their condition. Ninth is the in case of complicated infection, as in sepsis, endocarditis, or osteomyelitis, AST results guide the selection of potent and effective antibiotic that can penetrate the site of infection and eradicate the pathogen. During the infectious disease outbreak, AST helped to identify the most effective antibiotics to control the spread of infection and treat affected individuals, thereby mitigating the impact on public health. AST data inform national and international policy decision on antibiotic use, research priorities, and resource allocation for the combating antimicrobial resistance. In summary, antimicrobial susceptibility testing is a vital tool for optimizing the therapy, improving the patient outcome, reducing the resistance, and supporting public health efforts. Its clinical relevance cannot be overstated, as it play a key role in ensuring the effective and responsible use of antibiotics. This was all about antimicrobial susceptibility testing and its significance and methods to detect the susceptibility. In the next lecture, we will discuss antibiotic use for the specific populations like in pediatrics, pregnancy, lactation, geriatric, and in the immunocompromised patients. If you like the video, then share and subscribe to our channel Medical Guruji. Stay tuned, stay informed. Thank you.